Hi students. At this point we're going to be talking a little bit about some of the etiology and treatment for paraphilias. I'm going to be going over some of the different factors and some of the different treatment models to close out the chapter on paraphilic behavior. When we think about the etiology of paraphilias, usually we always start with the neurobiological factors. As you've learned, the physiological or biological basis of psychological disorders has really dominated clinical work and clinical research. So we always turn to that as a frontline explanation. We believe that male hormones or androgens play some sort of role. We know that almost all individuals with paraphilia are men. But what's interesting is that when we look at their testosterone levels generally aren't unusually high. They're not generally higher. They're not higher than the general population. So while some psychologists believe that there is a biological explanation to paraphilias, most don't. Most do not. A biological psychologist is going to point to the fact that almost all paraphilics are men, that testosterone is the defining difference. But when we actually start to dig into that population who has paraphilias, men who have paraphilias, their testosterone levels just aren't higher than the general population. Another theory as to what might cause paraphilias are classical conditioning. We've talked a little bit about this already, how paraphilic behavior can be learned or can be conditioned. This perspective believes that paraphilias are basically acquired through learning and they're rooted in childhood experience. So, for example, if a young man masturbates in the bathroom with his mother's stockings hanging from the shower, he may come to associate the stockings with pleasurable sexual experiences, and this may evolve into a fetish for stockings. There has been some research that does support this finding. So there's some research done by Rockman. He actually did videos where he spliced images of boots between sexually explicit images. And in the end, the participants found the boots or rated the boots as being sexually arousing. But there is a lot of research that has not supported orgasm conditioning. It just hasn't supported this hypothesis. Another theory does focus on operant conditioning that looks at the poor social skills that we see in individuals that have sexual paraphilias, and the belief that these poor social skills have a tendency to reinforce their unconventionality. In other words, because they feel so socially awkward, they avoid situations that can lend themselves to normal sexual interactions. And because there is pleasure or orgasm that is connected with an aberrant sexual behavior, that they continue to do that because it's reinforcing. So what are some treatment models for paraphilias? Often what happens with individuals that engage in paraphilias is that they end up incarcerated or they ended up in court-ordered treatment. Because often the treatment is court-ordered, it's very difficult to interpret outcomes. In other words, it's very difficult for us to determine how productive the treatment has been, or for us to evaluate the effectiveness or impactfulness of any particular treatment program. The studies have a tendency to vary greatly. We often don't have control groups to make sound comparisons. And the dropout rates are very, very high. So if we're going to engage in treatment of paraphilias, what models do we have? Well, the first step is always to enhance motivation. As I mentioned before, we have a pretty high dropout rate in terms of treatment. There's a lot of denial and minimization of the problem often present in these individuals who show up to treatment. So the therapist really has the therapist's first job and primary job is to bolster the belief in the client that they can gain control over the behavior, and to turn around and stress the potential consequences of failing to do so. In other words, there might be jail time, there's the erosion of relationships, a lack of intimacy, and so on. That's very important in order to keep that person coming back, in order to keep them engaged in the therapeutic process. Are there any biological treatments? As I mentioned, some psychologists do believe that there is a biological or physiological root to this that is connected to testosterone. So if medication is given, that medication is generally a hormonal agent that's designed to reduce androgens, particularly Depo-Provera. Basically, this is considered a chemical castration. What it does is it decreases the physical drives, and it does seem to work. But it doesn't necessarily decrease the psychological impulses. So this is sort of the problem with these medications. There's also some ethical concerns involved. Is it ethical to give a man a shot of Depo-Provera in order to reduce these physical urges to engage in sexually paraphilic behavior? And then there's also long-term physical side effects. How long do we use the medications? When do we stop? And giving these sort of hormonal blockers to men does have some long-term physiological impacts that need to be considered. There has been some treatment done with SSRIs. SSRIs are a class of antidepressants. They do seem to decrease some arousal to deviant objects, but there's just not enough support or research. There's not enough research done to actually support their use. In terms of behavioral approaches, really behavioral approaches have been the most comprehensive approach to treating paraphilias, the first one being aversion therapy. In aversion therapy, an inappropriate stimulus like a shoe is paired with a punishment. So when the stimulus is shown, say that person has a fetish for shoes, they are shown the image of a sexy shoe, then they're shocked. They receive a shock on their hand, or maybe the shock will be on their chest. And this is done over and over again until the stimulus is associated with the negativity, that they're connecting the shoe with the shock, and arousal is no longer happening. Arousal no longer occurs. In covert sensitization, the inappropriate stimulus like a shoe is paired with an imagined aversive stimulus, something like vomit or feces. And that person is supposed to imagine that until that connection becomes disrupted. Another cognitive behavioral treatment is to work on distorted thinking. It's not unusual for paraphiliacs to say things like, oh, well, this doesn't cause any damage to my victims. They may not know it, but they were being seductive. A lot of victim blaming. So to sort of work on that with them. And often these cognitive behavioral treatments are combined with social skills and empathy training. Social skills training can be very effective in helping those who suffer from things like voyeurism, exhibitionism. Often these individuals, they're socially inept and they have problems forming relationships with women. So this type of therapy in combination can be helpful.